Hey guys, Jason Lipoff here, Dr. J, and I'm finally getting around to recording a video in response to the child that was strapped, I think in Georgia, to the Papoose board, and the news media, as usual, decided to kind of let that get out of hand, and so I wanted to give my 2 cents on it, and I asked you guys yesterday, would you like me to do a little video on what my take is? So here it is. I'm going to be as brief as possible. For those of you guys that don't know, besides the personal success coaching that I do, besides what I do with network marketing with Team Beachbody, I'm also a board certified pediatric dentist. And I add board certified because there's general dentists where you go to 4 years of dental school. There's pediatric dentists where we do an additional 2 to 3 years of a postdoctoral residency, specialized in adolescents, children, infants, the care, special needs. And then there's board certified. You do not have to be board certified to be a pediatric dentist, but if you are, that means that you had gone through 2 phases of rigorous training, one being written, one oral, on certain guidelines. And basically what it means is, if you're board certified, same thing in medicine, is that you've proved to put in the work necessary above and beyond that is not required within your field. But it's an extra level of showing your hustle, your work, and your dedication. So I always say, when you're looking for a specialist, you want to get a specialist. And on top of that, you want to find a board certified specialist. So a lot of this information, my point of view, some of it is kind of this revolutionary way that I have my practice. And some of it is coming from the mind of a board certified pediatric dentist. So the case was, this child is papoosed, and it looks like they're mummified, they're restrained, their arms and their legs, and then the dad comes in, and the kid's screaming to high heaven, and I guess he was looking to get a tooth taken out. Dad flips out, goes in the media, how could you do this to a child, traumatizing him, all that stuff. So let me kind of, and I don't know if this person was in Georgia was a pediatric dentist or not, but I'll just kind of talk about a couple different things. The first thing is that Papoose boards are used in not only dentistry, in pediatric dentistry, but in many other phases where it is in the best interest of the patient and the doctor, for safety reasons, so that emergent treatment needs to be done, and it cannot safely be done otherwise, then passive immobilization is a treatment of choice if behavior management does not work, and if sedation is not a possibility. Active mobilization is like if the assistants or the parents are actually holding the kids down. Active mobilization is what I do in my office, but I will say it is much harder to do that, but you do have the parent in the room. So where's the issue here? I have a Papoose board, and I use it when absolutely necessary. But to overcome the parents and everybody in upheaval whenever you need to use it or whatever, you not only need to communicate with the parent, but you need to basically have them repeat back to you the consents of what exactly they're consenting to. Because I guarantee you that dad signed the consent for the Papoose. He didn't even know what it was. So, they're just like, whatever. I mean, how many times do we sign consents but we don't even realize it? So I think that's one thing. Another thing is that I honestly feel if you want to go with recommendations of who has the best reputation, whether it's a board-certified pediatric dentist or a regular pediatric dentist, you got to go to a specialist. Don't go to a family dentist, general dentist. They may be fine with children, but especially if they need treatment where they're going to need a Papoose, we have the ability to do advanced sedation. So we have a little bit more control of the situation, theoretically. I let all parents in the room, everything. If I'm papoosing them, if I'm orally sedating them, I let them in the room for everything. I make them fully aware that exactly what is going to go on, and if they are becoming, if I feel like they are a distraction, then I will ask them to kindly sit in the corner. But when you have the parent in the room, number one, that immediately that's trust. And you'll have some providers that'll say, well, but it makes treatment harder, and sometimes the parents get in the way. So what? That's part of our job. That is part of our job, is to establish rapport with even the most difficult parents. Because a lot of times they don't even want to be difficult, but they've probably been mistreated most of their lives. Maybe they're at a lower socioeconomic status, or maybe they're just having a bad day, or maybe their marriage is kind of on the run. Whatever it is, it has nothing to do with you. So you got to be empathetic for why they might be acting like that. So it's really important that you're empathetic to their needs. So if you let the parent in the room, you'll never get anybody leaving saying, oh my God, I can't believe what they did to my child, because I'm always telling them, hey, listen, I love having the parents in the room because I stress diet, nutrition, prevention. I want this to be an environment where we all work and we all learn something. And if it's ever uncomfortable for them, they can always say to stop. But I make it very clear that I only do things that is absolutely necessary. And if I do need restraint, then I will ask the parents sometimes to do a little bit of active mobilization. And if they're not comfortable with that, then I'll have my assistants. But I always ask permission. And people are like, well, but you're the doctor, you got to treat them. I have a different philosophy on that. I want to empower the parents, making them feel empowered. However, I really have control. And how do I get control? I get control by establishing rapport and by modeling and mirroring and really being empathetic towards the parents, towards the kids. Kids, they don't want to be difficult, but something is causing them to prevent them from trusting. Sometimes they're just pre-cooperative age, but sometimes it's past negative experiences. There's a lot of things. So I think that you kind of have to take a lot of things in consideration. Understand that I think that the reason why they do it is they mean the best to do past mobilization. But a lot of times, like these cool smiles and small smiles, granted they may be great providers, but if they're general dentists, they don't have the ability to use advanced sedation. Also, they also, like the way, if it's run with a corporate structure, a lot of times they don't have the ability to really take their time and bring the patient back for 3-4 visits, desensitization visits, where the way my practice is run, I can do that. So I think it's important that you understand what you're trying to accomplish, and I think that you should never watch the news. The news is ridiculous, so just turn it off. And make sure, especially with your kids, that you go to somebody not only that you trust, but that you really feel has a good reputation of really providing a positive impact for you and your family. And they're not just technicians, because it's why I would be one of the worst dentists in the world, because I have no interest in treating teeth. I honestly don't. I have an interest in inspiring parents and kids to lead a healthy, fulfilling life through their daily actions. And the signage on the door that says I'm a pediatric dentist, all that is a little invitation for me to start the conversation and make a difference in their life. So that's what you should seek out. It's not about the papoose, because we're all trying to do good in this world. All right, guys? I hope that helped. Any other questions, feel free to email me, message me, comment below. And I'd be happy to answer any questions you have. And if I'm actually thinking about doing a weekly webinar series for moms for kind of question and answer and things like that about diet, nutrition, wellness, things that how to raise your kid right, but how to basically give them the foundation so they can succeed. All right, guys, have a good one.